I'm the medical director of Mays Men's Health, and I'm really proud of our team approach, which we've adopted in the last 5 years. So on our team, there are 5 guys. There's me, who's a board-certified urologist specializing in male infertility and male sexual dysfunction, and that's all that I do. And since I finished my fellowship, that's all the part of the urology that I practice. We have a nurse practitioner who's fabulous, who is involved in almost all of the aspects of the care. We have a sex counselor, sex therapist who sees virtually every patient, and it's been extraordinary what that has done for our patients. The majority of patients won't go and see a therapist, and they're really not coming in necessarily for that, but as an adjunct to what we do, exploring what's going on in their sexual history, in the way that they're relating to their current partner, in the way that they have issues with relationships, in the way that their sexual functioning or lack of libido or ejaculation issues interface with their relationship. It's just been invaluable. And then we have an exercise physiologist on staff who does nutritional counseling as well as exercise and stretching and work, as well as very sophisticated testing of men's cardiovascular status and how that relates to their exercise.
So the benefits of the team approach, the multidisciplinary team allows us to identify multiple different aspects of what's going on with the patient. A lot of times patients will come in with multiple different problems that may not be addressed by just one of the clinicians, but addressed by all of them together. We've had patients who have come to us with deep-seated problems that have not been unearthed until they've seen other members of the team and not by sort of the quote-unquote main clinicians that see them, the nurse practitioner or physician. So a lot of times with the team approach, patients will come in with complaints of erectile dysfunction, libido problems. Those can be caused by multiple different issues. The team approach allows us to identify each of those issues and treat them specifically. Thus, we're treating the whole person and not just the specific complaint.
There are a lot of benefits to working with a team when it comes to medical care. First of all 4 of us are looking at very different aspects of the same person. And things come up just because you're looking at a person through a different lens, or we're asking all different questions. For example, we had one young man who was in here with erectile dysfunction, and we were running medical things on him. I did a whole sexual history on him, and it wasn't until he talked to the exercise physiologist that we discovered he had a drinking problem. And that was affecting his sexual performance profoundly. So we were able to then address not only his sexual issues, but his substance abuse issues from a medical, therapeutic, and even a physiological standpoint.